morning, I'm Tanya. I am the director and esthetician in UniSkin. Listen, I want to talk to each one of you that's my clients, and also maybe want to be clients, soon to be clients, think about becoming my clients. Whichever way, I just realized I need to tell you a little bit of what I offer and why I offer it. So one of the things, my strapline is I put things right. Something is amiss, something is bothering you, and you are looking for someone to fix it. That's me. I put things right. But more than that, I've got 29 years of experience in medicine and nursing and worked in various places. And one of the key things that I realized, and why I call myself UniSkin Wellness, is that wellness, there are several pillars, but the four prominent pillars that I've learned about is physical, emotional, social, and financial. If one of those go missing, it becomes unstable. And in your own life experience, if you just think about something, I'm going to relate to myself, I can relate to thousands of clients, of patients I've seen come through the door. When they are socially experiencing difficulty at work, maybe they've been bullied, maybe they're in the wrong career, etc. They start to have self-doubts. They start to have palpitations. Self-doubt, palpitation, self-doubt, emotional, palpitation, physical. So they start to get anxiety. They don't enjoy the job so much. They start to not sleep and then can become depressed. So the point I want to make is physical, social, emotional, financial must always be in balance. And I have got a way to explain this as well. I've practiced it and I've messed it up a few times this morning. So here's my fourth time. So here is our pints. Always, you've heard this, a pint half full or pint half empty. In any case, the point I want to make, this is your physical, this is your emotional, this is your social, and this is your financial. If I take, this has happened again, if I take one off, can you see the others become unbalanced? So, how could we fix this? In UniSkin, I offer a multitude of services, and I'm well known for the Botox and the fillers and those type of things. I do a full facelift, I do a full patient assessment and approach. I'm going to call you patients because when you come through my door, I do assess you physical, social, emotional. And the reason I do that is because I'm looking to see where you're tired. I look at the condition of your hair. I look at how your skin look in general. I see other signs and symptoms. I've diagnosed many patients with deficiency in my clinic, but this is the point I want to make. I want to and can put things right. So when you are feeling tired, looking miserable, yeah, I can fix that. I can do a Botox, I can do a filler, but I'm so much more and I can do so much more, and I have a wicked team I'm putting together to do this. So also hair rejuvenation, nutraceuticals, vaginal restoration, skincare, etc. So there's blood test, DNA testing. So there is so much more to UniSkin than just maybe Botox and fillers. There's also years of experience of having a lot of various knowledge in psychiatry, psychology, right through to managing disease. So I want to pull that all together in a unique offer to you. Wellness is about having those four things in place. There's more things, there's things like spiritual and environment. Now, again, I just want to postulate this to you, that if you are feeling in optimum health, physical, social, emotional as together, that might impact on you financially. I'm sorry, I can't sort your finances. And in fact, I take some off you. But the point I want to make is sometimes when you are not feeling great in yourself, or you are upset about the way you look or the way your hair look, or feeling so tired and fatigued, you don't really want to socialize. And then again, that might also impact on the way and in your work relationships, or going for another job, or just having the confidence. I don't know. That's why I say I can't do anything about you financially, even if I say all four of those, but I can make a difference in your life. And lastly, just before I finish, soon I'll be opening a clinic. And this clinic is a boutique clinic. So we want to offer you a service that is like nothing else you've ever experienced. It needs to feel right for you. I'm working with a bunch of wonderful people to create this clinic when you come in, so you are in a fantastic place and an environment, and that from start to finish you cared for. And that's the last thing I want to say. As nurses, we care, and I really care. I realize this is why I'm in this job. I also realize that there are a few things that's missing in the NHS. I've been there. I've sat on the one side in the GP side, and I've sat on the other side as a patient. I've gone in with massive hair loss, and I still couldn't get the problem solved. I took years and years to study that and to find out what's the best solutions I can have. And now I can fit in that little niche between GP services and beauty, etc., because I know what's missing, and I believe I can fix it. So the last thing I want to say is you are incredibly valuable. I really value each one of the patients come through my door, and I thank you for those beautiful patients I already had a fantastic journey with. And I just want to leave you with a last thought is, whatever I can, I don't want to overpromise, but I can put things right. I should have and do have a lot of your solutions. Have a wonderful day. Take care. Bye-bye.